I'm Sam Liu. I work as the supervising physician for the services here with the MEDii. In terms of what we do here, we look after a lot of patients that have walk-in medical acute issues, as well as people who are well and generally want a health screening, preventative medicine, as well as the well-being side of things that need intravenous nutritional therapy and things like MEDii or certain vitamins and elements replacement. So this is the Fuji point of care NX600, and this is a machine that we've been provided by Fujifilm for point of care blood testing that gives rapid blood results in terms of biochemistry to the clients here with MEDii. The idea we wanted to get the machine was so that it can give us very rapid results and clinical data for decision making for our walk-in patients who have medical issues, as well as people who are here for well-being and having nutritional therapy. We need to know their baseline liver and kidney function. Only a couple of weeks ago, we had a patient that came over here, 60-something-year-old father visiting the daughter who was a worker here in the UK. Came here lethargy and malaise for several days, was sleeping excessively during the day. Came over here to MEDii and was drowsy, GCS reduced, and we needed to find out what exactly is going on. And machine told us glucose was very high, there was a kidney failure, and electrolytes were not good. Sodium was very high, potassium was very high. So actually the patient had HHS, which is hyperosmolar, hyperglycemic state. HHS has a high mortality in a diabetic patient. So with that, we were able to get the LAS here very quickly. Actually, the LAS was here within 20-30 minutes, which is very good. I think the blood test made that communication with the ambulance crew very formative, so that they can quickly take the patient to UTLH. And the patient was there for 4 days, treated and discharged. It has exceeded my expectation in terms of the actual impact in patient care. So it's been amazing. Before, we used to get the patient in, or we need to have some kind of blood test from the patient in the background for us to be confidently giving patient, clients, having nutritional therapy safely from our perspective as clinicians. But now with this, patient can walk in here, they can have a blood test on the spot, then they can have the IV NT within 30 minutes, within 60 minutes. And so that really rapidly increases the patient experience. They don't need to wait. Sometimes before, we needed to have the blood test sent to a lab and then come back in the afternoon and have that infusion. So that increases the turnover for the clients. It's good experience. In terms of the acute medical issues, as we mentioned, it's very useful. People who come in with a fever, they have come in with what looks like a wound infection, and we want to know whether this is a virus, whether this is bacteria. Having that C-reactive protein, having the renal function helps us to adjust the treatment we have for the patient. Some of the good features are, number one, it gives the results on printed paper. You can take it to the clients, you can show them, you can tick off. The other thing is it's able to, and we're in the process of setting it up, where it's communicating with the partners of Fujifilm, where we can see the results on the screen. It's modifiable. It can be white labeled and print the results out and formatted in a way that will be compatible with our clinic's presentation style with the results to the clients. When we set out to look for point of care machine, which was part of the business plan, there were several companies that were on the selecting list. And Fujifilm was recommended by one of our friends who was a CEO of a private hospital that was outside of London. This gives us that higher percentage of clinical certainty, and when the clients get that, and they can tell in front of them a piece of paper that clearly states the blood results, that they're happy and they're leaving with a smile. They're leaving knowing that they have a plan. And we have a lot of that with the machine here. More of that, I say. And as clinicians at the department, we're smiling because we're also taking a risk normally when we're making a decision without knowing certain things. And we're used to dealing with that. But the more certainty we have, the more confident we are. We're happy that we know in our mind that we are giving our clients the best. We're giving them the best clinical judgment with more data. It's like having more tools in a box. When you do surgery, you need more tools. The more tools you have, the more certain that you're giving the best. So we're very happy with that. I'm very happy with the machine, very happy with it. A little bit cliche to say that we work not with the company or the brand, we actually work with the people that are coming from the brand. And the experience has been very, very exceptional. I say that because we as a business developer, as a clinic that's growing and development service all the time, we communicate with many different providers of products and services. And I think Fuji, the reason we're a partner now is because the level of efficiency and professionalism that Fuji has shown us. From the first point of contact, Iggy has been very responsive and efficient in getting back to us and has been consistently on the case. We were very lucky to have very solid partners as Fujifilm, and we have very high ambition in developing MEDii, and there are many avenues we want to explore. And I just want to thank the team for helping us to fulfill a dream that MEDii has, which is to provide the very best care that we can, and not just in words but in action, to the clients. And the machine technology really help us to deliver that. So I just want to thank the team for time and dedication, efforts, and flexibility in a negotiation, in getting the service, in giving us the quality that we have today to help us to achieve the next milestone, which we'll get there.